I'm Nancy Law from the Myasthenia Gravis Foundation of America, and I am honored to be here tonight with Dr. Jeff Guptill of the Duke University School of Medicine. And what is particularly exciting for me about being here with Jeff is that Jeff was MGFA's very first fellow through our collaborative fellowship, postdoctoral fellowship with the American Brain Foundation, right?
That's correct.
Is that correct? So, Jeff, you are also a grantee from MGFA, and I'd love for you to tell us a little bit about your work.
Sure. Well, first I'd like to, say that I'm very thankful for all the support that the MGFA has given to me in my career, over the years. So our lab is primarily focused on identifying biomarkers that predict how patients respond to therapies. Right now, a lot of what we do in treating patients is not very evidence-based, and we just choose therapies, not on a whim, but without a lot of evidence to suggest one versus the other. So we think that there are probably immune markers in the immune system that can help us to determine which patients should receive which therapies.
Wow, that would be such progress instead of trial and error, which is sometimes what we seem to go through these days.
Yeah.
So that would be awesome. So that's terrific. Talk to me a little bit about clinical trials and how patients can participate both in the work that you're doing at Duke and also in other clinical trials that may be coming up before very long.
I guess the first point to mention is that there are lots of different types of clinical trials. So there's clinical trials that investigate experimental drugs and therapies. There are other types of clinical trials that help us to better understand the immune system or understand the disease or how to measure the disease. And all of these are very different with different risks associated with them and different levels of participation that are required. So I think it's very important to make that distinction and to be able to talk with your treating physician to see what the options are and what might be the best particular choice for you. But without the help of patients, we're not going to be able to make a difference in the disease. We need the help of patients in order to participate in the trials that can bring more effective therapies to the MG community.
Well, thank you very much. I appreciate so much the work that you're doing for being here today at our international conference, and it's a pleasure to work with you.
Great. Thank you, Nancy.
Take care. Thank you.